for his tremendous leadership on this important issue that is just really tormenting so many Americans right now, as well as Senator Wyden. This involves tens of millions of Americans who are facing a healthcare crisis. Their premiums are doubling or tripling, and it is completely in our hands to do something about it. Open enrollment is ending in 2 days. Americans across the country are looking at their budgets and facing this difficult choice of whether to pay double or triple for coverage or go uninsured. And why are tens of millions of Americans facing this reality? Well, because congressional Republicans failed to act, to come to the table, to negotiate an extension of the Enhanced Affordable Care Act tax credits before the end of last year. Last Thursday, the House passed legislation to extend these health care tax credits for 3 years. 17 Republicans joined Democrats. You think about it, they could have done that months ago. Months ago. We were willing to negotiate with them 3 years, 2 years, 1 year at the time. They wouldn't do anything. And now they've realized, I guess they didn't understand what was happening to their constituents when 20-some% of farmers and ranchers are on these kinds of policies, and 75% of them are in red states. This legislation that Senator Warner and Wyden have proposed is simple and reasonable. We're simply saying, let's make sure the same tax credits that make care more accessible for tens of millions of Americans yesterday and last year and the year before that continue to be there for families this year. Americans are looking for us to act, and the time to act is now. I've heard from people across my state in what is a very, very difficult time right now in the state of Minnesota, with the arrival of ICE on our streets, with people terrified, with the chaos that has ensued. We are still hearing from people about health care all the time. Nikki from Waseca wrote to me that the health care premium for her and her husband almost tripled from $862 a month to $2,344, which over the course of the year is more than her annual salary. She called the increase insufferable. Nadine from Sartell, a 53-year-old single mom, shared that she has a master's degree in social work but lives nearly paycheck to paycheck now because her housing and utility costs eat up over half of her monthly income. And unless Congress renews the health care tax credits, she's not going to be able to purchase health care. Of course, there's only 2 days left. And here's the kicker. Just 4 months ago, she was diagnosed with breast cancer. She's already used up nearly all she has in savings for the copays and coinsurance to get a diagnosis and receive treatment. Another constituent, a school bus driver named David, saw his premiums double. He's now spending 12% of his total pre-tax income on health insurance. David wrote that it's difficult and frustrating to see life crumble before your eyes, just trying to get ahead and just to find setbacks waiting for you. I would like Congress to actually sit in real life people's shoes for just a while to see how it feels. I hope we can get something changed. That is a bus driver in Minnesota begging our colleagues on the other side of the aisle to stand and sit in his shoes. Because if Congress can't fix this, David shared with me that even though he works full-time, he will have to give up his health insurance entirely. The rules that Senator Warner and Senator Wyden and others of us have suggested do away with the caps that limit how much of their income people like David must spend on health insurance. And so as we work to extend the health care tax credits, it's critical that we stop the administration from further undermining the Affordable Care Act and raising costs. And this just isn't happening in my state, as I know 3/4 of the people who get their health coverage on this ACA marketplace live in states that President Trump won. We know the stakes, and we must come together to solve this affordability crisis. And I will note that the amount of money given to Argentina was approximately the same amount it would take to fix this for 1 year. There's a lot more work to be done to lower health care costs. Medicare price drug negotiations that I have led for years and making sure that's really happening under this administration, reforming prior authorization, making improvements, public option, we go on and on and on. But right now, we have one crisis that is hitting so many Americans, and we have a way to fix it. So I urge my Republican colleagues to join us to stop Americans' health care premiums from skyrocketing and simply bring to the Senate floor and pass the bipartisan House-passed bill to extend the health care tax credits that Americans rely on, and of course, to vote for SJ Resolution 84, which is in front of us today, and we thank Senator Warner and Wyden for leading the effort. Thank you, Mr. President. I yield the floor.
President,